Hi, this is EK. Today we're going to talk about electrolytes and fluid balance in the body. Just one quick housekeeping issue. When you see a question on the Nclex that asks you to select your first option or your initial nursing action, go for the assessment option, the assessment answer. So any answer that includes assessment or collecting data, even if it means asking a patient a question, that's still an assessment. Except in an emergency, remember, follow the nursing process, and especially when you see a question that says first or initial action, that is usually an assessment answer. And then if the options you're given do not include an assessment option, follow the steps of the nursing process. So ADPIE, ADPIE, assess, diagnose, which is the nursing diagnosis, plan, implement, evaluate. Go for your answers in that order, except again in an emergency. Now to the electrolytes. We're going to discuss calcium, potassium, sodium, magnesium, phosphorus. The first we're going to talk about is calcium. Normal range is 8.6 to 10 milligrams per deciliter. Hypocalcemia is highly tested on the Nclex. And when they test hypocalcemia, they will test the Trussell sign, which is a spasm of the arm, of the fingers, caused by ischemia. So like when you take blood pressure, that pressure you apply to the upper arm cuts off blood supply temporarily to the distal nerves, and it elicits your fingers having spasms. That is the Trussell sign. The other sign that is associated with hypocalcemia is Chevostek. So that's when the parotid gland area is tapped, the facial muscles start to spasm. That is also due to hypocalcemia. Typically, when a patient has hypocalcemia, one of the teachings the nurse would give to the patient or family is to increase their intake of foods that have high calcium. So milk, cheese, yogurt, preferably low-fat yogurt, soy milk, rhubarb, sardines, spinach, tofu. Those are foods that are high in calcium. For hypercalcemia, that will result in formation of calculi, renal calculi. The second electrolyte we're going to discuss is potassium. Normal range is 3.5 to 5.1 milliequivalent per liter. Well, give or take. The Nclex is not going to mess with you with 1 or 2 or 0.2 or 0.1. They're going to give you figures that will make sense. So don't be too worried about if one book says 3.5 to 5.3, another book says 3.5 to 5.1. Potassium imbalances can be life-threatening because potassium affects every body system. On an EKG, you should be able to identify normal kalemia, in which case you have normal QRS, and then hypokalemia. So the things to watch for on the EKG for hypokalemia, you will have a slightly peaked P wave, slightly prolonged PR interval, shallow T wave, prominent U wave. For the patient that has hypokalemia, they will have thready, weak, irregular heart rate or pulse. They will have weak peripheral pulses, orthostatic hypotension, muscle weakness, leg cramps, and paresthesia, tingling. The treatment for hypokalemia is to administer potassium supplement orally or IV, but diluted in an IV. We never give potassium by IV push. We never give potassium by IM or subcutaneous routes. Otherwise, it's going to send the patient into cardiac problems. Hyperkalemia. For this patient, they have slow, weak, irregular heart rate and decreased blood pressure. If hyperkalemia is present in a patient, which means the potassium is too high, we discontinue IV potassium. We hold oral potassium supplements if a patient is on that. We initiate a potassium-restricted diet, And sometimes we can even give a potassium wasting diuretic, such as Lasix. You can call it potassium wasting or potassium excreting diuretic. Foods that are high in potassium include dark green leafy vegetables, dried fruits, oranges, orange juice, bananas, whole grains, beef, legumes, strawberries, tomatoes, potatoes, and milk. The third electrolyte we're going to discuss is sodium. The normal range for sodium is 135 to 145 milliequivalent per liter. For hyponatremia, which means the patient's sodium is lower than 135, we instruct the client to increase their oral sodium intake. We teach them foods that are high in sodium to consume. So all processed foods are high in sodium. Bacon, butter, canned goods, cheeses, hot dogs, ham, ketchup, mustard, lunch meats, soy sauce, white bread, all snacks, and tomatoes. If a client is taking lithium carbonate, please monitor the lithium level closely because hyponatremia will cause diminished lithium excretion, which will lead to lithium toxicity. For hypernatremia, which means sodium that is higher than 145, we restrict the patient's sodium intake, so they should avoid all processed foods. Now, talking about processed foods, all natural foods like vegetables on the Nclex, aside from tomatoes, I can't think of anything that's natural that is high in sodium. So please, when you see an option of vegetables or spinach or stuff like, natural foods, they are not high in sodium. Those will not be your option to pick for high sodium foods. Next is magnesium. The normal range is 1.6 to 2.6 millimoles per liter. Magnesium sulfate is used as an anticonvulsant for women with preeclampsia and eclampsia. During the administration of magnesium, we monitor the patient for diminished deep tendon reflexes, which are indicative of hypermagnesemia. The antidote to high magnesium levels is calcium gluconate. So whenever you administer magnesium to a patient, have calcium gluconate at the bedside. Foods that contain magnesium include avocado, canned tuna, cauliflower, and green leafy vegetables like spinach or broccoli. The fifth and last electrolyte we want to talk about is phosphorus. The normal range is 2.7 to 4.5 milligrams per deciliter. Phosphorus and calcium have an inverse relationship. So as phosphorus goes up, calcium goes down, and vice versa. Foods that are high in phosphorus include all dairy products, fish, legumes, nuts, pork, beef, chicken, whole grain breads, and cereals. Now to body fluids. Generalized edema is called anasarca. And when you have pitting edema, 1 plus is 2 millimeters, 2 plus is 4 millimeters, 3 plus is 6 millimeters, and 4 plus is 8 millimeters. On the Nclex, when you calculate I and O, be very careful. So if a patient takes 60 milliliters of orange juice at breakfast and lunch, remember when you're adding all the figures, multiply 60 by 2 first, because when they say at breakfast and lunch, they're not going to tell you to multiply by 2. But if you don't do that, then your calculation will be off. And they will give you an option that has an answer without the 60 being multiplied by 2. In discussing body fluid balance, we're going to talk about insensible loss, which is called that because the person is unaware that they are losing water. And this is water that is typically lost from the skin or through the lungs, through respiration. Fluid volume deficit. This is when you have an insufficient amount of body fluid due either to poor intake of fluids, use of diuretics, hemorrhage, which is bleeding, excessive perspiration, vomiting, diarrhea, GI suctioning, ketoacidosis, or diabetes insipidus. Signs and symptoms of fluid volume deficit include increased temperature, thready rapid pulse, diminished peripheral pulses, decreased blood pressure, flat neck veins, flat hand veins, poor skin turgor with tenting. Nursing intervention is to provide oral rehydration, IV fluids if the dehydration is severe. Also monitor for electrolyte imbalances and treat as appropriate. Fluid volume excess. This is when there's a greater amount of fluid in the body than is needed to meet the body's needs. This condition is also called overhydration or fluid overload. It may be a result of renal failure, congestive heart failure, long-term steroid therapy, syndrome of inappropriate antidiuretic hormone, rapid infusion of an IV solution, or excessive sodium intake. Nursing considerations for fluid volume excess. When you assess the patient, you're going to notice bounding rapid pulse, increased blood pressure because of overall increased circulating fluid volume, increased respiratory rate, dyspnea, moist crackles on auscultation of the lungs, pitting edema in dependent areas, ascites, distended neck veins, distended hand veins. Treatment is to administer diuretics, restrict fluid intake, restrict sodium intake, monitor INO, monitor weight, monitor electrolytes. So to recap, sodium normal levels 135 to 145 milliequivalent per liter, potassium 3.5 to 5.5 milliequivalent per liter, calcium 8.5 to 10.9 milliequivalent per liter, magnesium 1.5 to 2.5 milliequivalent per liter, phosphorus 2.5 to 4.5 milliequivalent per liter, chloride 95 to 105 milliequivalent per liter. Please don't forget to like, comment, and subscribe. Thank you for checking in with EK. Bye for now.